A new study in New York State finds 13.9% of people test positive for COVID-19 antibodies in their blood. That means 2.7 million people in New York State have likely already been infected with the coronavirus. As of right now, there are 257,216 confirmed cases of COVID-19 in New York State, and 15,302 people have died. That's a crude case fatality rate of 6%. But if the true number of infections in New York is 2.7 million, which is more than 10 times the number of confirmed cases statewide currently, and 15,000 people have died, that is an infection fatality rate of 0.5%. And keep in mind, the 15,000 deaths includes probable cases too, which is absurd. And before anybody makes a fuss about that comment, that is not my speculation. That's straight from the CDC and the New York Health Commissioner. You can see for yourself. The CDC says they're coding probable cases as COVID-19 deaths. This means if you have COVID-like respiratory symptoms and you die, even if you never tested positive for COVID-19, they will code you as a COVID-19 death. You tell me if that makes sense. All you have to do is look at the data. Because most COVID-like symptoms aren't actually COVID. It's some other respiratory virus. How do I know? Because look at the percentages of people who are tested for COVID who test positive. Even in hotspots, less than half of symptomatic people are testing positive for COVID-19, which means more than half the time, people with COVID-like symptoms don't have COVID-19. And yet, New York is coding anybody who died with COVID-like symptoms as a COVID death. That inflates death numbers for sure. Now, in New York City specifically, this same study found that 21.2% of people who were tested positive for COVID-19 antibodies. On Long Island, 16.7% of people tested positive for antibodies. This is a randomized study. They took 3,000 random samples from 40 locations in 19 counties, which means it's intended to be representative of the population, which means you can extrapolate it to the population. So for New York City, the population is 8.4 million. If 21.2% tested positive for antibodies, then perhaps 1.78 million people have already been infected with COVID-19 in the city. That means even in the worst hotspot in our country for the virus outbreak, it's a 0.6% fatality rate. And remember, patterns in these studies are important. The New York antibody study found the same number of people who tested positive for antibodies as the New York City maternity ward, who tested 210 asymptomatic women and found 13.6% of them tested positive. This is similar, too, to antibody studies from Santa Clara, California, and LA County, and the study out of Kansas, and the Diamond Princess cruise, and Dutch, German, and French studies that all show much higher incidence rates of the virus, and therefore much lower hospitalization rates and much, much lower infection fatality rates. And you may hear some people say, well, COVID-19 is still 5 to 8 times deadlier than the flu. But that's misleading because it's only partly true. Of course, 0.5% fatality rate is not good. It's definitely not good. For people over the age of 65, yes, COVID-19 is deadly at a much higher rate. But for healthy people under the age of 65, and for children specifically, COVID-19 is much, much, much less deadly than even the seasonal influenza. In fact, another recent study in the Journal of the American Medical Association found that 94% of hospitalized COVID-19 patients in New York City had serious underlying health conditions. The medical community calls that comorbidities. 53% suffered from hypertension, 42% were obese, and 32% had diabetes. The median age of a hospitalized COVID-19 patient in New York City is 63 years old. Now, this isn't to downplay the virus. We should do everything we can within reason to protect these vulnerable populations of people from COVID-19. But it's this data and not the doomsday projection models that should be informing political policy. And you should make sure your elected officials know that.